Good. Hi there. My name is Molly. I will be your provider today. I first did my 8 pre-procedural steps. So I checked the chart, washed my hands, knocked on the door, introduced myself, shut the curtain, came in, introduced myself. Like I said, my name is Molly. What is your name and date of birth?
Jessica Peterson, 12489.
Great. And Jessica, what brought you in today?
I got a rash on my leg.
Ooh, yeah, it looks like a nasty one. Okay. When did this start?
Earlier.
Okay. How is it just in that location? Do you have it in any other places?
It's just right there on my leg.
Okay. What would you say the pain intensity is on a scale from 1 to 10?
A 7.
Okay. Do you know if you had an exposure to anything that could have caused this?
I was out cutting the grass, so it could have been poison.
Right, okay. Have you taken anything to help this?
Some Benadryl.
Okay.
Some Benadryl and some cortisone cream.
Did it help? Did it help the rash?
No.
Okay. Are you hurting anywhere else?
I have a headache and chills.
Okay. And do you have
And my
any?
IV side hurts a little.
Oh, okay. I'll take a look at your IV site here in a minute. Do you have any other related factors? Okay. I'm going to get your vitals here in a second, but first I'm going to ask you some questions. Do you know what time of the day it is? Is it morning, afternoon, evening?
It's afternoon.
Okay, great. Do you know where you are right now?
I'm at the hospital.
Okay. Do you know who the president is?
Biden.
Okay, so I would say alert and oriented times 3. I would also say she's appropriately dressed for the season, adequately groomed, and she is giving me response to verbal stimulus, which is all appropriate. Now I will be taking your vitals, so I will ask for those. Okay, great. Ooh, I see you got a temp, girl, or hairy leg man. I see your temperature is 101.8 Fahrenheit oral, which is above normal limits. So I would say a normal temperature would be anywhere from 97 to 99.1, or you can say 95.9 to 99.1. So you definitely have a temperature. Your heart rate is 122, so you're a little tachycardic, which means you have a faster heart rate than normal. A normal heart rate is 60 to 100. You have normal respirations at 18. Normal respirations are 12 to 20. Your blood pressure lying down right now is 142/90, which is elevated. The normal blood pressure you want below 120 and below 80 for diastolic. Do you have any hypertension, a history of hypertension, of high blood pressure? Okay, do you take medication for that?
Metoprolol.
Okay. Your O2 saturation is 95% according to your finger probe. I appreciate that. And it looks like you're on room air. Do you use any oxygen at home?
No.
Okay, great. Okay, great. So vitals are done. I'm going to be checking. I'm going to do a quick assessment of you and a focus assessment of your wound here in a minute. I'm going to say your head is normal cephalic. Your eyes are beautiful. Okay, so take a look at me. Okay, great. I would say her eyes are, Perla is great. So her pupils are equal, 3 millimeters, and they're looking great. Okay, so that's good with your Perla. I also see that her sclera is white, conjunctiva is pink, no drainage, no tenderness. Great. Let me take a look at those nostrils. Okay, so look up real fast. Okay, great. I see no drainage, no exudate, no nasal flaring, so respiratory looks good there. And I see it's moist and pink, adequate. And I'm gonna have you open your mouth and say, ah. Okay, great. I see gums, mucosa is pink and moist, and I see you have no missing teeth. And do you have any loose teeth?
No.
Okay, helpful to know in case you need to go in a procedure or anything. I'm gonna take a look at your ears. Okay, I'm gonna pull down and out. Okay, her tympanic membrane looks white, no drainage, and her ears and eyes and nose look symmetrical to her face, and ears are equal and same as eyes. So I'm proud of you. Okay, so now I'm gonna go to her neck real fast. Sorry, I'm gonna try to speed it up. Okay, so her trachea is midline. I can shift it side to side. Her thyroid is non-palpable, which is appropriate. Her neck is supple, no rigidity. Okay, so that was that. Okay, now I'm gonna take a look at your skin before I forget. And sorry, my hands are real cold. So yeah, just, lack of circulation. Okay, so your skin is normal for race and ethnicity. Your turgor looks great. Your tinting is less than 2, so you're adequately hydrated. I'm gonna do your cap refill, less than 3 seconds, so that is appropriate. I'm gonna have you squeeze my fingers right now. Okay, equal strength bilaterally for musculoskeletal here in a minute. No edema, as well as I can see. I would say 0 edema, which is great, and skin is warm. I don't know if I said that. Okay, so now I'm going to go to cardiac, and I'm gonna put my nifty stethoscope on right now. I'm gonna act like it's in my ears, but since I'm talking, I don't wanna do. So I'm gonna go right side, this is here. Okay, I'm gonna go up here. This is her aortic, and this is where we're gonna hear S2. And then I'm gonna go to your pulmonic right here, S2. I'm gonna go to Erb's point. This is where I'm gonna hear S1, S2. I'm gonna go to your tricuspid down here, and this is where I'm gonna hear S2. And then your mitral, which is where you're also gonna hear apical pulse here in your 5th intercostal, and this is where you can sometimes listen for a minute, and you're gonna hear S1. I hear no murmurs, so I don't hear S3, which is great. I just hear S1, S2. I see that circulation is okay with her fingers. I'm gonna check your pulses now. I'm gonna check your radial pulse. Okay, I can check her brachial right here, her carotid, her popliteal, her dorsalis tibius, and then her pedis, whatever, I forget that one, but this one's important to make sure circulation goes all the way down, and yours does, so I'm really proud of you. Okay, so that's your cardiac. Now I'm going to go to, it's catching my hairs. Now I'm gonna go to your respiratory, and I'm gonna assess you first. Do you have any trouble breathing? No. Okay, so no work at breathing. I see no retractions, no nasal flaring, no use of accessory muscles, no tripod breathing, so that's great. I'm gonna listen to your chest. I'm gonna listen in 5 places on each side in the front. 1, 2, 3, 4. Or you can take 1 deep breath as I do that. Great. 1 more, other side. Great. And I'm gonna do this 1, 2, 3, 4, and then 5. And then I'm gonna go to your back, and I'm gonna do the same thing on your back. I'm gonna have you take a big deep breath in and then out. Great. And I'm gonna go 1, 2, 3, 4, 5. And some people do it differently, but that's just how I listen to my back. And also if she's having any breathing issues, I can go across her spine and have her say 99, 99, 99 across each side of her spine. That all looks good. I see your respirations are also within normal limits because they're 18, as I said earlier, with your vitals. Your heart rate too, I heard S1, S2, but it is just a little bit fast right now, and it could be, because you're febrile, likely you have a temperature, which could increase your cardiac, and you have a wound, an infection. Okay, so that is that. Now I'm gonna do your abdomen, your GI. So I'm gonna have you sit back and get comfortable, make yourself at home. Okay, great. Here, I'm always going to listen first before I touch your stomach to make sure I don't rile anything up, if you know what I mean. Okay, so I'm gonna start in your lower right quadrant, and I'm gonna work my way up. So I'm gonna listen here for 1 minute. I'm gonna listen for 1 minute in each quadrant. It all sounds great. 10 to 30 vowel sounds in each quadrant. And I'm gonna end on your lower left, and you had 10 to 30, like I said, so normal active bowel sounds. And then after I'm going to auscultate, I can then palpate, and I'm gonna palpate light to deep. And do you have any pain?
No.
Okay, great. So I did that in all 4 quadrants. All looks good. When was your last bowel movement, Jessica?
Yesterday.
Okay, was it normal consistency? Was it loose? How?
It's normal.
Great. And have you had any appetite changes lately?
No.
Okay, great. Any food sensitivities?
No.
Okay. I'm also gonna check your IV site here. And you said you're having some pain?
Yes.
Okay, let me take a look at that. I'm gonna try to flush it right now. It looks patent. It looks like there's no infiltration. Not exactly sure why you're having pain, but we'll look into that after my assessment further, if that's okay with you. Sounds great, thanks. Okay, now can I have you sit up real fast? And I guess I'll do GU right now, since I just did some bowel movements. Can you tell me, are you having any urination issues?
No.
Okay, how does your urine look?
Clear yellow.
Okay, great. So it seems like you're staying real hydrated. Okay, perfect. So now I'm gonna be doing some musculoskeletal. I'm going to have you stand up. I'm gonna feel your hips real fast, and they feel equal and symmetrical. Both limbs look same length, which means your hips are in alignment. I'm gonna have you walk straight and watch your gait. Gait is steady, no shuffling. Okay, great, and you can stay right there. I'm going to have you press up, great, press down, and then can you give me a little range of motion? Okay, so I would say normal active range of motion. With your arms, I'm going to have you abduct your arms, so lift them up, and then adduct, bring them in. Okay, and then with your foot, actually let's do hands like this, so supination, pronation, and tact, great. I'm gonna have you plantar flex, dorsiflex, great, and then abduct, adduct, crushing it. Appreciate that. Okay, you can take a seat back here if you'd like. Yeah, great musculoskeletal system. Okay, I'm gonna do neurovascular, the questions I didn't do before. So I already mentioned you're having no pallor because your skin tone is normal for race and ethnicity. Are you having, I'm gonna check paresthesia now, are you having any numbness or tingling anywhere?
No.
Okay, great. And I see you don't have paralysis because you're able to adequately move your limbs. Okay, now I'm gonna take a look at your wound right now. Wow, okay, that looks like it hurts. So I think we're gonna give you some morphine, and I'm going to talk to the physician. And then for safety wise, I'm going, thank you for your hairy leg, appreciate that. I'm going to, when I came in, I should have lifted the bed. Now I'm going to lower the bed. I'm gonna lift the rails. I'm gonna put the call light next to you, and I'm gonna ask if there's anything else I can do for you. I'm also going to say, since you have a wound, I need to check RETA, which would be redness, ecchymosis, drainage. So drainage, you look for dehiscence, and if there's approximation, and I would say it is red, you're having some ecchymosis. Are you having any drainage? Have you had drainage from this?
No.
Okay, and it looks like it's approximated to just that one area of your leg so
Itching
far.
and burning.
Shoot, okay. Well, I'll talk to the physician about that. Do you need anything in the meantime?
No.
Okay, great job. Done.